I've worked in the health service for the last 12 years, trying to look at opportunities to digitalise. And I think the main challenges that I see isn't really about the technology, it's more about the service design and the redesign of health and care, and actually how they change their system. There's a lack of skills in innovation, and there's also a lack of skills in change management. So I think we probably have all the technology that we'll need for the next 10 to 20 years, but it's how do you apply it to actually bring a better quality of service and a better quality of life to the patient. I think the healthcare sector will look different. However, in the past it's taken 20 years to embed innovation. So I think it's a slower process than other sectors have seen, and the transformation of that might be a wee bit slower than what we're expecting today. However, I do think that the realisation that health and care isn't sustainable will actually start to change that. And I think we'll see much more access to data, data sharing, and the ability to do more with technologies like wearables, and actually trying to bring that consumer data back into statutory service so that the clinician, the practitioner, the social worker gets a much more holistic view of that person that they're trying to look after. I think technology has a massive part to play with health and care, and I think everybody realises that, but I think it's about where are we going to actually get the biggest impact, and where are we going to gain the biggest traction for the outcomes of the people that we're trying to look after by using technology. And it might not be actually just looking after people that are ill, it might be much more focused on preventing illness and making sure people remain well for as long as possible, predicting issues before they happen, and allowing people to live in the community as healthy and as happy, I suppose, as they can. Okay, well, the barriers to adoption, in my experience, and in working with Digital Health and Care Innovation Centre in Scotland, is very much about change management. People do see the promise of innovation and technology. However, they actually struggle to see how they will need to change their service and their proposition, whether it be a service delivery proposition or a business proposition of those that are selling into the health and care sector. So I think there's definitely a movement and a shift now to try and understand how do we actually overcome these key barriers that we've seen for the last 10 years. And actually it's about skills, it's about the softer stuff, it's about procurement, it's about trying to work in partnership to actually change the system. And that is essentially, you've got to do that by co-designing new systems and services with the people that are going to use them, but also the people that are delivering them, and also the businesses that are going to have to deliver that business proposition into the service. Well, I'm here today representing the Digital Health and Care Innovation Centre, which is based in Scotland and funded by the Scottish Funding Council and Scottish Government. I was invited to present what the future may look like for health and care in cities in the next 4 to 10 years. And I think some of the key insights that are coming from Scotland and some of the activities that we've done in Scotland actually demonstrates how we are trying to transform ideas into real solutions that will actually make an impact on people's health and care.